Robotic surgery is revolutionizing the landscape of healthcare, and Orlando Health is leading the way. Joining us now to talk about yet another exciting breakthrough is Dr. Lucas Wiegand with Orlando Health Medical Group Urology. Thanks so much for being here with us today, Dr. Wiegand.
Hi, Elizabeth. Happy to be here.
Okay, so robotic surgery, we know there are a lot of advantages: shorter recovery time, better outcomes, and it really comes down to the small, precise incisions that you make. Why are those so important?
With robotic surgery, we know that the advancement has been decreasing the size of the incisions. And now with the single port robot, we have been able to change where we put those incisions so that they're in areas that are less painful and promote even faster recovery times.
Okay, so what types of patients would you potentially be using this for? What procedures would they need, and where does it make the most sense?
A lot of what I'm doing is cancer survivorship or congenital problems. What that means is that patients that have recovered from their cancer operations that cured the disease, and now they have ongoing problems that require further treatment, and this allows us to do that in a collaborative way.
A lot of times post-cancer treatments, the patient is fragile. They, have really been through a lot. So does the fact that they only have to go through one procedure to fix problems, really just extend the amount of time that they're not in recovery and,
Absolutely. There are patients that are having to stop their cancer treatments that are ongoing, chemotherapy and things. And so the faster that they can get back to those treatments, the better their ultimate outcome will be, while also no longer having these problems from their original procedures.
I bet you have a lot of success stories from this.
Sure. I mean, a case comes to mind where a patient, a young woman, had multiple abdominal procedures for a cancer where they were done through a big open incision multiple times. The single port robot allowed me to make a very small incision away from where all the other surgery was and really pinpoint down to the area where the problem was. And she was able to go home the next day.
Wow.
And this problem that was causing her to essentially be in diapers was fixed. And so this patient was able to get this procedure that otherwise would have required another big open incision and all the risks that go with that in a week or more in the hospital in a way that was minimally invasive and very much easier to recover.
And if you would like more information, you can visit orlandohealth.com/urology.